Welcome to WESB's Community Spotlight on B107.5.
This week I talk about blood sugar with Dr. Ken Redcross, and Nick Youngs discusses liquid natural gas with Toby Rice from the Partnership to Address Global Emissions. I'm Andy Paulson. This is Community Spotlight. Stay with us. Halloween is this weekend, which means a lot of people are going to be eating a lot of candy, which means that a lot of people's blood sugar is going to be spiking. And, of course, we've got Thanksgiving coming up, which is also going to throw a lot of people's diets out of whack. So we're going to be talking about blood sugar and how important it is with our resident health guru, Dr. Ken Redcross, this morning. Doctor, thank you very much for joining me again on Community Spotlight.
Oh, thanks for having me, Andy. It's great to be with everyone.
Thank you. Now, a lot of people, when they hear blood sugar, they just think about diabetics, but really everybody's blood sugar has a lot to do with their health.
It really does, everyone. And I'm glad you have me talking about this, Andy, because, when we think about an elevated blood sugar, obviously we always go to diabetes. But let's recognize as well that an elevated blood sugar can also lead to heart disease, to strokes, to kidney disease, and also disease of the eye. So when you think about elevated blood sugar, everyone, don't just, bat an eye and say, oh, that's not me. I'm not a diabetic. So let's take it seriously.
Now, what is considered high blood sugar? And at the same time, what's considered low blood sugar?
Well, look, so we typically diagnose diabetes, everyone. If you go to your doctor and you get a fasting blood sugar, meaning that you haven't eaten overnight, usually that number is over 126. Or if you go and you've already eaten and didn't know you were going to get a blood test and it's over 200, that's also a positive number. Now, I will say this, a lot of people think that blood sugar being low is quite common. It's not as common unless you're a diabetic who's maybe being treated with insulin or something that's bringing the sugar down. Some people have it, but typically below 70 is what that diagnosis of hypoglycemia is, or low blood sugar.
Now, what happens to us when our blood sugar gets out of whack, either too high or too low?
Well, so everyone, unfortunately, what happens when the blood sugar gets elevated, which is happening all too often these days, is that, I've already mentioned it, diabetes, and we know that diabetes not only affects our heart, but also the brain as far as the derangement or changes in our cholesterol. So look, as we're thinking about the best way to stay healthy, it's really understanding that there are some things that we can do to help balance our blood sugar, but it all starts with understanding and knowing how to not only get it checked, but what are some of the signs and symptoms that your blood sugar, of some of you listening right now, may be elevated.
Now, what are some of the warning signs that we can look for?
Well, look, it's a little bit of a challenge sometimes, Andy, because some of these symptoms are a little non-specific. Like one of the bigger ones, patients will come to the office and they're incredibly fatigued. But Andy, this isn't a regular fatigue like, oh, I've had a hard week at work. No, they kind of feel like they always describe kind of a stuck in the mud sort of feeling. The other thing is increased urination. Now, this is one not to blow off everyone. I'll have two different kind of answers that come in. I'll have my men say, oh, well, I'm in my 40s and 50s. It must be my prostate. And my women will sometimes say, I've had urinary tract infections. It's probably just that. I'll get some cranberry juice. And I'm always like, no, please don't ignore those symptoms, okay? Because increased urination is a really big deal, especially your sugar is elevated, everyone, in this example. So if your sugar is incredibly elevated, that sugar's got to go somewhere. It goes to the bladder, and guess what? Water follows to the bladder, and then you're finding yourself urinating a lot, especially at nighttime.
And cranberry juice just makes you urinate even more, and it's got even more sugar in it.
Yeah, and I'm glad you brought that up, Andy, because the other thing, everyone, and for my women there who are dealing with the urinary tract infection, if you are going to get cranberry juice, Andy's right, it's got to be the good stuff. It can't be some of the bigger names out there that have sugar. It has to be pure cranberry juice, which is not easy to tolerate, but it does help.
What are some of the ways that we can get our blood sugar under control, hopefully without medication for most people out there? Hopefully we can catch them before it turns into diabetes.
Yeah, look, so that's the key, everyone. So I always say, look, it's because your sugar is elevated. It's not your fault. And I promise you, it's not your fate. So we're going to do 2 or 3 things that can make a difference, or talk about them. Number one, take a stroll. Go out and exercise, especially after dinner. The studies already show that not only is it improved because when you eat, your blood sugar spikes, but when you go out about 60 minutes after, you get a really big bang for your buck to help balance your blood sugar. The second thing, I want you to learn about the important herbs and spices that are out there that don't necessarily treat the blood sugar, everyone, but they can support your normal levels to keep it in that range. Number one, cinnamon is a big one. I love it, especially this holiday season that we're talking about. Not so much at Halloween that's coming up shortly, but for Thanksgiving and for Christmas. But one of the bigger ones, we all have heard of cinnamon, but have you heard about berberine? Now, I mentioned that cinnamon and berberine are similar in that they're both barks, Andy, but I like berberine because not only does it do the heavy lifting to help balance our blood sugar, but it also helps balance our cholesterol as well. And so, look, there are some things out there that could really be beneficial if you go out and you look at the right supplement stores to help you balance this. You know, people always ask me, Andy, where do I go and what do I kind of think about? I always talk about Healthy Directions. It's a company that I like because they already do a lot of the research, especially around blood sugar. I know everyone out there has ones that they go to as well. So just make sure that the studies and the science is there, like when I mentioned Healthy Directions and some other good ones out there.
I was diagnosed with diabetes earlier this year, and
Oh,
I had to start testing my blood sugar on a regular basis. And people, they tend to think of, oh, you've got to prick yourself and bleed on this tiny
right,
little strip, and then
right,
you stick it
right.
in this thing. But my doctor pointed me at a device called Pogo, which is everything self-contained. There are really easy ways to test your blood sugar if you have to.
Yeah, there really are. You know, lots of time, a long time ago, you're right. It used to be that diabetes was like, oh my gosh, my life is going to be turned upside down. But Andy, I'm glad you brought that up because you are proof that it does not have to be turned upside down. Things have really changed to make it very, very manageable. But we want to talk about it on shows like this so that we can recognize those signs. I mentioned fatigue, increased urination. There's also increased thirst, blurred vision. And I'm interested to know, Andy, when you were diagnosed, did you have any of these signs and symptoms that we're talking about?
Well, fatigue, but I thought that I
Yeah,
chalked that up to
yeah.
the job here.
Yeah, exactly. And that's what we typically do. That's probably the number one reason or the number one sign that's missed, Andy. You're absolutely right. It's that fatigue. We just chalk it up to either being fatigued at work or just stressed out. And we shouldn't. And I'm glad you went in and got the diagnosis and are on a good therapy and regimen.
Now, I mentioned the holidays, and I heard you muttering in the background, oh, yeah, when I mentioned Thanksgiving. How do the holidays and especially the relationships that we have with people around us affect our health this time of year?
Like, it's fascinating to me. So when you think about not so much Halloween, right? But definitely for Thanksgiving and Christmas, we get together and that can sometimes, Andy, bring out what I call the S word. That's stress, everyone. I don't like to say it. But during the holiday season, stress is a big, big thing that we need to make sure it's stamped down. And the reason why I say that is because when you have a lot of stress as you're running around, your cortisol levels are elevated. Cortisol is something that's supposed to be helpful for us, Andy, but not chronically. And so when you're there with family, let's make sure we do some deep breathing exercises and try to remember the reason why the holidays were created to bring us all together. And now, hopefully, to talk about our relationship with blood sugar as well.
Now, how can our audience connect with you and learn more about some of the tips that we talked about today?
Oh, sure. So I hope everyone reaches out and that you've learned something today. You can reach out to me at Dr. Ken Redcross at any of my social media handles or my website, which is drkenredcross.com.
drkenredcross.com. Thank you very much, Dr. Redcross, for joining me on Community Spotlight. And let's help everyone get through this time of year with their A1Cs at a reasonable
Yeah,
level.
exactly. I love that advice, Andy. Thank you. Thank you for having me on. Stay healthy, everyone.
And same to you.